Right. Okay. So this is an interview. This is an interview. You hear an interview with a nurse. So she's a nurse and her name is Lianne Haddock. Haydock, who is talking about the issues, talking about the issues involved in caring for obese, okay, or plus-sized patients. Obese patients or plus-sized patients. So you have 90 seconds you have to read, and the questions are 37 to 42. So we'll do like this, like how we did earlier. Now let us see question number 37. Now go through this question number 37 now. Only 37, because you think how you are dealing with this. Then I will tell you how you have to deal with this. Lianne or Lion or Lianne or Lianne. Lianne feels that in response to increasing numbers, in response to increasing numbers of plus size patients, nurses should do what? Nurses should do what? Nurses should do what? Take a lead in educating them about the risk. Educating. So education, to take the lead in educating the patients about the risks. Okay. Yeah, take a lead in educating them about the risks. Take a lead in educating them about the risks. So be proactive in investigating what lies behind the problem. Be proactive in investigating. Second role is investigating. Okay. What lies behind the problem means reason. What lies behind the problem means reason behind this problem. So investigate the reason, educate regarding risks, education regarding risks, investigate what lies behind the problem, So the reason, behind the problem, there is a reason behind, lies behind the reason. Okay, reason behind the problem. Be proactive. Proactive means very active. Pro, favor of. Remain focused on providing them with the best possible service. Providing service. Best possible service. So educating about risks, investigating the reason, and providing service. So it is just educating them or investigate the reason or providing, okay, them with the best possible service. Now educating. So what should the nurses do? What should the nurses do? Okay. Should they educate them about the risks? Because there are many risks here involved. Okay. Or should be proactive in investigating what lies behind the problem. Okay. Be proactive in investigating. So investigate the reason why they have this problem. Or remain focused on providing them with the best possible service. So what is the role of nurses? What is the role of nurses? Which is the most important one? Education. So provide education. Is education important for the nurses? Should they investigate the reason? Investigate the reason is research work. Educating is training work. Remain focused on providing them with the best possible service. So they have to provide service. Nurses how to provide service normally. Okay. There is no need for them to investigate what is behind them because there is a research wing. The doctor will order tests and the tests will send some results, and based on that one, they will investigate. Investigation is the problem of the specialists. Okay, multidisciplinary action. Educating. Educating is training. Training them about the risks. That should be given even before they have these problems. Okay. So, what is the nurse's role? What is the nurse's role? Nurse's role is to take care of the patients, not educating them. Education anybody can give. Education anybody can give, not only nurses. Even if you read the books, you will get. From the internet, you will get. From the textbooks, you will get. From the medical journals, you will get. They can get from the brochures. If you can give a brochure, they will understand about the risks, or a pamphlet, or a video, or a lecture, or a podcast. They can learn. Education can be done anyway. Education can be done anyway if you think logically. If you think logically, education can be provided in any way. Is it the responsibility of the nurses? Huh? What is the duty of the nurses in this regard? Okay. When caring for obese or plus size patients, caring means take care of them. Education is taking care of them, that's all. Next one, investigating what lies behind the problem. Investigation. Nurse is a nurse. She is not an expert. What is there behind the problem? How will she know? She can guess or she can analyze, but how can she confirm? Even doctors cannot confirm. They have to go for some tests like X-ray or any MRI or blood tests or some things. Based on that one only, they can investigate the problem. So, it's not one-man army show. Only nurse cannot investigate what lies. There is no need for a nurse to investigate actually. That is not a part of her duty. She is just a nurse. She is there to provide service to the patient, not to investigate the reason behind why this lady has this obesity or all these things. Is she going to educate? Education, just to give one brochure, they will study. Okay. That's so by default, you can understand that C is the answer by default. Do you need an audio for this one? Huh? Do you need an audio for this one? Education can be done in multi-dimensional approach. Multi-dimensional approach. A doctor can give, a pharmacist can give, okay? A physiotherapist can give, a dietitian can give, or uncle, brother, sister, father, mother, neighbor, anybody can give education. Okay, they can learn, they can read themselves from the internet, from the newspaper, or anywhere else. Why I am telling you all these things? Because there are some things even without, you can logically deduce the answer. So take a lead in educating them about the risks. What is the role of a nurse? Is it education, the main role? Nurses should, not may, should. Should means compulsory. Is it a compulsory responsibility of the nurse to educate the patients about the risks? For example, I am educated. Why should a nurse educate me? I can go online. I can read from the medical journals. Why should a nurse? Why do I need a nurse to educate me? Tell me. So that's ruled out by logic. Because should means 100% must. Should means must. Nurse need not. She has no responsibility there. And nurse may means okay. Nurse should. Nurse should. Should means must, means 100%. Must definitely do. What is definitely educate them? Is an obligatory or optional? Educating them, providing education is what is that? It's an option. It's not an obligation. It's optional. For example, the nurse doesn't know everything about everything. Na? How can a nurse know everything about everything? That also rules out. B. Be proactive in investigating what lies behind the problem. Investigation? Investigation is a very broad concept. How can a nurse investigate? Is she authorized? Is she trained? Is she certified? Like a doctor to diagnose, investigate what lies behind the problem, diagnose the problem? Is she an authorized or certified personnel to confirm what is the problem? A nurse. A nurse is an assistant to a doctor. Investigation is the responsibility of a doctor, not a nurse. Okay, she can imagine, she can assume, she can guess, or whatever it is. But is it her responsibility? Should she, must and should investigate the problem? Should means 100%. Try to understand the power of the word should. Should means compulsory duty. Should means compulsion. May means obligation, no, optional. But should means should, must, ought. These are the words which shows that it's 100% responsibility of the nurse. Nurses should means must. It's a duty. That's the point. No, it's not her duty to educate. It's not the duty of to investigate. Nurse only can provide service. Is that clear, Ruwani? Jasdeep?
Yes, sir.
Yes, sir.
Is that clear what I am telling?
Yes, sir.
Should.
sir.
Try to understand the power of the word should. Should means 100%, definitely. For example, if you do not educate the patients, will the doctor punish you? Will the hospital punish you? No. If you do not investigate what lies behind, will the hospital remove you from the job, or will they punish you? No. But if you do not provide them the service, best service, yeah, you will be questioned. You understand now?
Yes, sir.
So this is how you have to judge the answers. Why I am telling you all these things? What is the reason? Okay. What is the reason behind this? So here there are two options. So, which are not necessary. Education, it is not the responsibility. Should means responsibility. Should educate. Why should a nurse educate the patient? Only if she is told she can educate. Otherwise, it's not a responsibility. Investigation, is it her responsibility? No. That is the duty of a doctor. Okay. So, provide service, providing service, providing. So, service. This is the most important word. Providing service. Service is the most important word. So, what is should? Should means compulsion, 100% responsibility, punishable offense otherwise. Okay. So, think like this. Then only you will get the answer. Now, go to 38th question. Go to 38th question. Yeah, study this 38th question now. Think very carefully. Yeah. So see here very carefully now. Next question. Yeah. What attitude? What attitude? So talking about attitude, what type of attitude? Means that type of attitude. Some type of attitude. So adjective. Towards plus size patients does Lianne find unacceptable? Not acceptable. Okay. Not acceptable. So now a belief that they are somehow to blame for their weight. So they are somehow to blame. They. So who the patients are to blame. So it is their problem. It's their mistake. So it's you are blaming the responsibility on the patient. Because of you only you have this problem. Because your carelessness, you are so much weight. You are plus size patient because you don't take responsibility. It is your mistake. It is your mistake. It is your mistake. It is your mistake. So you are telling the patients that it is their mistake. Number one, a belief that they are somehow to blame for their weight. So telling the patients, it is your mistake. That's the point. So they are the reason for their situation. They are obese because they are not taking responsibility. They are not careful. They are reckless. They are careless. That's what you are saying here. Try to understand. So a belief that they are somehow to blame for their weight. Who is to blame? The patients are to blame. The plus size patients. They are already obese. They have a problem. So blaming them, it is your mistake. Whose mistake? Patient's mistake. So that's unacceptable. Number one. Number two, a lack of interest in the medical reasons for their weight. A lack of interest in the medical reasons for their weight. Okay. Medical reasons. Medical reasons. A lack of interest. A lack of interest in medical reasons. So, a lack of interest in medical reasons. So, they are not interested in medical reasons for their weight. Okay. A lack of interest in the medical reason. Oh, I am obese. So, what is the reason? What is the problem? Is there any medical problem? Is there any health problem? Okay. The patient may not have that interest to go for checkup. Okay. That is acceptable maybe. Because she is not interested to go to the doctor. Okay, my father is like this, my mother is like this. Okay, I'm eating too much or I'm eating, maybe my health problem, something. And you are not going to the doctor. Okay, to find out. Okay, why you are obese? What are the reasons for your obesity? You don't have any interest to decrease your weight. Okay. So this is okay. This is acceptable because they don't have interest. Nah? That's fine. Because they don't have interest in medical reasons. They don't have that interest. Lack of interest means they don't have interest in the medical reasons for their weight. They don't want to find, they don't want to identify, they don't want to research. They don't want to explore what are the reasons behind their weight. So that's okay, that's acceptable. A tendency to assume they have been trying to lose weight. Yeah, this is also acceptable. A tendency to assume they have been trying to lose weight. Okay, when they are obese, they think, a tendency to assume, they believe. Okay, trying to lose weight. Okay, I have gained weight, so I will lose weight. Okay, I have gained, so I will lose. So because of that tendency, that's also acceptable. Okay. So what is the problem? I'm trying to lose my weight. Somehow I will try to lose my weight. First one, A. So the patients are responsible. They are to be blamed. It is their mistake. So how can you say that it is their mistake? Even if their mistake, how can you blame them? How can you talk rudely to the patient? How can you blame somebody? You can guide, you can suggest, you can support, but how can you blame somebody? Do you have any right to blame anybody for anything? Huh? Will they accept? For example, you take a thief. You blame him. You are the thief. He will accept? No, he will not accept. He will not accept. And without solid proof also, you cannot blame somebody. And if you have proof also, they will not be ready to act. Who are you to tell me, they will say. Nobody will be ready to take the blame. So by default, you understand that A may be right answer. Maybe not is, maybe right answer. 50-50 chance. A lack of interest in the medical reasons for their weight. They're not interested in the medical reasons for their weight. They don't want, they don't have that interest. I'll go to the doctor, I'll get checkup, I'll do some tests, I'll find out what is the reason behind. They don't have that interest personally. If somebody tells, maybe they will do. But they personally don't have that interest to go to a doctor and check. This is acceptable. Chances are there. Many people are obese. They don't have the interest to go to the doctor and find out the reasons. Okay, that's acceptable. If they don't have interest, that's acceptable. Right? That is definitely acceptable. A tendency to assume they have been trying to lose weight. Yeah, some people, if you ask, they'll say, yeah, I gained weight. Now I'm trying to lose weight. Yeah, I'm trying to lose weight. I'm trying to lose weight. No problem. Maybe within 1 or 2 months, I'll lose my weight because I'm trying. I'm trying level best. I'm eating less. I'm doing exercise. I'm doing this. I'm doing that. I'm trying to lose weight. That is also acceptable because they are doing something. Is it unacceptable? Is it acceptable? They are trying their level best. First thing is B. Okay. They lack their one type of people. They're not interested. They don't bother about it. They're not serious. They're not concerned or worried or upset with their weight. Okay. They'll take it as granted. Finish. Okay, I'm fat. What can I do? What should I do? Maybe they don't have medical knowledge. They don't have a proper education. They don't have that inquisitiveness to find out the reasons behind that. 50% of the people are like that. Okay, I'm thin. Okay, I'm fat. Okay, I'm normal. Okay, I'm tall. Okay, I'm short. Okay, like that. It's one normal condition. 50% of the people accept it as it is. So is that unacceptable? That's acceptable because majority of the people are like that. They don't bother about their obesity. They don't bother about their obesity. They're not much serious. They don't want to explore. They don't want to find. They don't want to research on that one. They don't want to go to the doctor. They don't want to do some tests. Why they? No, they don't want because they take it as just like that. Okay, going on life. That is acceptable. Majority of the people are like that. They are not from medical professional to accept everything. Okay. Yeah. Right. So that is acceptable. Next, a tendency to assume they have been trying to lose weight. The first type is we cannot do anything. B. We cannot do anything. What can we do? What can we do? I'm becoming heavy. I'm becoming obese. What can we do? That is helplessness. Helplessness. So they are not interested to find whatever. Okay, I'm growing fat. What is the problem? Okay, carry on. Second one is those people are accepting the fate and going on like that. That is 50% of the people. And another 50% of the people are C. They say, okay, I'm gaining weight. I know that. What can I do? I cannot do anything. They are not saying I cannot do anything. I can do something. The B type of people are saying we cannot do anything. We cannot do anything. B is telling we cannot do anything further. What can we do? We are helpless. We cannot do anything. But C, we are trying to do something. C is telling the 50% of the people are saying, C, they are saying, we are trying to lose weight. We are trying to do something. B is saying we cannot do anything. C is telling we are doing something. Both are right. Both are acceptable. Some people say we cannot do anything. Okay. Yeah. Some people are saying we cannot do anything. That is B. Some people are saying we are trying to do something. We are trying to do something. That is C. B is acceptable. C is acceptable. But how can you tell somebody you are fat? It is because of your carelessness. It is, you should take the responsibility. I'm blaming you for your obesity. How can you be rude to someone? How can you be insensitive to somebody? Logic. If you go and tell, will you go and tell your father you are obese because of your carelessness? It is because of you only. It is because of you only. It is because of you. Can you tell your father? Can you tell your mother? Can you tell your brother or sister or wife or husband or son or daughter or your friend? How can you be telling a patient then? You cannot tell your own people. How can you? So logic is very important here. This is not something from the audio. This is from your mind. How can you blame somebody that they are responsible for their obesity? Okay, another angle, let us see. Heredity. What is heredity? Heredity means from genes. Genetically, some people are obese. Grandparents, parents, like that one. Some people are obese. They are obese. Now tell me, try to understand. Okay? How can you blame them for because of their genetics, because of their genes, passed on from the father and mother to the children? How can you blame the patient for that? That is in her blood, that is in her body, that is in by birth she got. How can you blame her? If it is genetic factor, how can you blame her? Okay, another option, acquired. For example, parents are poor, parents lack knowledge, parents are uneducated, parents are not bothered, parents are putting their children in the hostel, and children there, they are eating whatever they want. And nobody is guiding them, nobody had educated them, nobody told them this is how you have to. So they're eating a lot of things, junk food, this, everything they're eating, whatever they're getting, and they're growing fat. Is it their mistake? If you tell them, if you are the mother or brother or sister or friend, if you tell them, they will understand, they will follow. But nobody told them. For them, is it their blame? You can blame them. Nobody told me. So how will I know? How can you blame? Okay, even after all these things, how can you go to somebody who is already obese and you tell them because of your carelessness, because of your negligence, because of your ignorance, because of your foolishness, because of your madness, you are obese? Can you say like that? It's rude. It is rude. And nursing is politeness. It's totally against. So, a nursing behavior, a nurse cannot behave like that. She cannot blame somebody. This is very common sense question. Okay? When nurses are giving helping the patients, providing service, can they blame the patient? If the patient complains, the manager or the hospital dean, they will lose their job. Totally immoral, unconventional, and illogical. So unacceptable. Very simple. Without the audio, you can get this answer. Without the answer, audio, you can get answer. Yeah, 50% they say we cannot do anything. That is B. 50% people say we are trying to do something. That is C. So trying to lose, trying. Okay. And 50% no interest, lack of interest, no interest. We have to say lack of interest. Okay. Lack of interest. Yeah, that's acceptable. No interest. 50% have no interest. They are not bothered. They have too many things to bother. This is one simple thing. So they take it lightly. And 50% of the people say, we are trying to lose weight. Both are acceptable. If they don't have interest, that is acceptable. If they're trying to lose weight, that is also acceptable. But you going and blaming somebody because of their is rude and nonsense. So you cannot blame somebody. Blame is a negative word. Blame is a negative word. You cannot blame anybody. You cannot blame anybody. Nobody will accept a blame. Okay. Nobody will accept a blame. Okay. Be careful. Negative words are not acceptable. So unacceptable. That's so simple. Yeah, Ruwani and Jasdeep. Do you understand?
Yes, sir.
Yes, sir.
Do you need audio for this simple question?
No, sir.
Huh?
No, sir.
No,
What is the need for audio for these two questions? Tell me. There is no need at all.
Mm.
Unacceptable means not acceptable. That's it. Rudeness is not acceptable. Blaming somebody is rudeness. Blaming somebody is rudeness. For example, your brother is walking on the floor. Okay. You are walking on the floor. But what happened? You have spilled some milk or oil there, and your brother slipped and fell down. Now, what you will say, oh, I have spilled some milk, I have spilled some oil, but you should be careful. No, you are careless. That's why you fell down. So you are blaming the child, your brother. Blame should not be there. You cannot blame anybody. You have to be sympathetic with the person who is suffering. Okay, you cannot say, no, I have spilled the milk, but okay, what about your eyes? Don't you have eyes? Can't you see? That is blaming. Blaming is rude. That is not acceptable. I hope you understand what I am telling. Next, we are moving to C, 3. 39, question number 39. 39, come on. Go through this question in the same way as how I explained. Question number 39. Yeah. Question number 39. Lianne suggests adopting an approach to caring for parents that. So approach, a method, a strategy, a technique. Lianne suggests. She's suggesting what? So adopting, accommodating, incorporating an approach regarding caring for patients. So it should be positive. It should be positive. Okay. So you have to understand this particular question. Makes special provisions for those defined as plus size. Makes a special provision to caring for patients approach. This approach should make a special provision. Okay, special provision for those defined as plus size, only plus size only. Special provision only for plus size. Okay. Only for plus size. Special provision for only plus size. Why? If they are not plus size, they should not be given special treatment. What does that mean? So plus size, this is plus size. For example, 100 kilograms weight is thought as plus size. 100 kilograms weight is thought as plus size. For example, what about 80 kilograms people? So no special provision for them. No special provision for them. Only plus size should be given special attention, special privileges, special options, special treatment. Makes a special provision for those defined as plus size. Those who are plus size, for them only special provision. Why? Why only for them? Why only for them? That means other sizes, a little less than plus size, they should not be given special importance. Why? Huh? Should they not be given special? Only plus size, only 100 kg. For example, 100 to 150 kgs or 100 and above or plus size, suppose. So that means 100 above only should be given special importance, special priority, special treatment, special care, special attention, special management. Only for those. Then what about the others? They are not special. That means they should be neglected. They should be given ordinary treatment, ordinary provision, ordinary management, ordinary respect, ordinary attention, ordinary treatment. Every individual is important. Everyone should be treated specially. Okay. You can't say that only plus size should be given special importance. That means if two people are there, for them only you will give importance, others you will not give. Why not? Everyone should be given special importance. Every individual should be given special importance. You are a nurse. You should treat everyone equally. Huh? Should treat everyone equally. Only plus size, no. For example, 90 kgs weight. So you won't give special provision for them. 80 kgs. You won't give special provision for them. They are not special for you. You will not bother about them. You will not give them special attention. You will take them lightly. They are not important for you. Special means important. That means others are not important. Huh? They have special problems. That doesn't mean that only they should get special provision. No. Everyone should get special provision, but they have special problems. That is different thing. It doesn't mean that they only should be given special problem attention. Attention should be given to everyone. Special importance should be given to everyone. Okay. They have special problems. That's okay. Next, is able to accommodate the needs of peoples of all sizes. All sizes. Yeah, this size, this sounds accommodate. Accommodate the needs. Those are defined as plus. Only those people plus. But here, all the people, all the sizes, whether 40 or 50 or 60 or 70 or 100 or 150. No, everyone you have to accommodate. Everyone is important. That's the point here. So you are accommodating everyone means everyone you are giving importance. Not special providence to somebody. All sizes, 100, 110, 120, 140, 150, 200 or 50, 60, 70, any size. All the patients should be given importance, not just who are plus size. So by default, I think B has more chances. A, no. If you say special provision should be given to plus size people, that means the normal people will get angry. See, she is very obese, so we have to give more importance to her. Why? Why more importance to her? Give equal importance. She is a patient, I am also a patient. Okay, that means in your hospital there are 10 beds, means you will give only admission to only obese patients. You will not give to normal patients. Huh? Near to obese patients, what about them? So you will not accommodate them. You have to accommodate the needs of all sizes, whether they are obese or non-obese, normal or heavy or whatever it is. Caring for patients, not only for obese patients, it's for all patients. Lianne suggests adopting an approach to caring for patients that, okay, try to understand all sizes. Okay. So here, caring for obese or plus size patients, it doesn't mean that only them you have to take. No. If you are giving special priority to plus size people, that means you are giving less priority to other people who are not obese. For example, I am 70 kgs. I am not obese. Okay. So that means you will neglect me. You will not give me special importance. You will not treat me with respect. Like how you are giving more respect to them. You will give me less respect. For example, in your house, you have two children. Will you give more importance to one son and less importance to another son? Just because they are bigger or smaller? Equal love, equal respect, equal attention, equal, everything equal. Right? Care is equal, responsibility is equal, everything is equal you are giving. How can you do that unequal attitude? Special, my elder son is very obedient, so I love him more. You love your younger son less because he is not obedient? Actually, you have to love him, you have to take care of him more and make him obedient. Responsibility is more there. Okay. So equal love, equal responsibility. For example, your father and your mother. Do you love them differently? Do you give special importance to your father because he is giving you money? And you are not giving your mother because mother is only cooking food for you? Both equal importance you will give. You will not give one higher and one lower. That's it. Suppose if in your house father is giving less respect to mother, then you will go and support your mother. If your mother is giving less respect to your father, suppose, so you will support your father naturally, na? Both are equal in your eyes. In the same way here also, whether plus size or normal size, everyone is important. Everyone you have to give special importance. Special importance to one person means lesser importance to the other person. How can you give lesser importance to somebody who is a patient? Tell me. By logic, by common sense, it applies very clearly that you cannot give more importance to one and less importance to one. No. Yeah. Emergency patient is there, ordinary patient is there. Okay. Admission you can give everyone. Everyone you are giving importance. You will give bed for him, you will give bed for him. But who is urgency case? That you will deal first. That is different thing. Because life and death situation there. It's not special importance. Importance is there, but according to the urgency of the matter, you will give. Okay. Priority based on urgency. That is different. Don't take the same thing here. So, is able to accommodate the needs of people of all sizes. Yeah. A nurse should accommodate the needs of people of all sizes. That's 100% right. Do you need the audio for this one? Don't you know that you have to accommodate the needs of all people of all sizes? That is accepted, whether he is tall or short or fat or thin, okay, child or middle-aged, youth or old-aged, whoever it is. You have to accommodate the needs of all people. Now, for example, urgent case and ordinary case. The need is urgency for urgent cases, emergency cases, accident cases, serious cases. So according to the need, you have to give the treatment. Okay. Not for rich people, more importance, less poor people, less importance. Not like that. So B is logically reasonable. We don't need audio for this one, I think. Involves a reassessment of what represents a typical size. A reassessment of what represents a typical size. What is a typical size? No, whether it is a typical size. What is the typical size means acceptable size. Acceptable size means, for example, 50 to 70 kgs. Typical size. Maybe, for example, a person is very tall. For him, 60 to 80. For example, he is 11 feet tall. Then it will be 80 to 100. So there is nothing called typical size here. It depends on the body. It depends on the heredity. It depends on the acquired characteristics, hereditary characteristics, eating habits, exercise habits. There are many things. You cannot say this is the standard size. There is nothing called standard size. It depends on the body mass index or the typical size depends on height, weight, and age. Many different things are there which contribute. For example, a boy who is 12 kg, 12 years old cannot be 50 kgs. Okay, so how can you tell a typical size is 40 kgs or 50 kgs or 60 kgs? It depends on age. It depends on height. It depends on weight. Huh? So all these are there. So there is nothing called standard, a perfect standard called a typical size. You cannot assess depending on something. There is nothing called typical size. It depends on person, place, situation, age, height, and weight. Okay. Typical size depends on all these factors. So there is nothing called typical size. So if it is a typical size, that means other sizes. What about the other sizes? So you have to assess every time a patient, and then you have to guess whether it's a typical size. Then you have to approach the patients. Can you do that? Every time you go to a patient, you will reassess the patient, whether he is typical size or not. How can you say he is a typical size? You can only assume, but you cannot assess. Assessment means diagnosis, means confirmation. Assessment means confirmation. Reassessment means perfect confirmation, a definite one. How can you do that? That this is the perfect size for Mr. Simon Peter. So that's ruled out. There is nothing called a typical size. There is nothing called typical size. There is no standard rule. So C is by default gone. Okay. So you have to make special provision for plus size. That means less provision for non-plus size. That means you are categorizing two people and giving less priority to non-plus size and more priority to plus size. How is that possible? Is that okay? For example, you have a son who is obese and you have a son who is normal. So you give special provision to obese child and you will give less provision to normal size. Is that okay for you as a mother? So a person caring the patient is like a mother, like a father, like a nurse, like a doctor, like a medical professional, a hospital or a medical organization. Can they do that injustice to people because of the size you are categorizing and giving more importance to the plus size and less importance to the non-plus size? Is that right? What does your common sense say? What does your education, what does your, what does your reason, logic say? Can you differentiate two people and give more importance to one person and less importance to one person? Is that justified? Professional justice is there in that? No. So A is ruled out. B is able to accommodate the needs of people of all sizes. Yes, this is absolutely right. Whether it's plus or minus or normal or neutral or average or above plus, whatever it is, double plus. All the sizes, whatever the size is, you have to provide them care. Okay. Plus size. Then again, in that also there will be groups. Lower plus side, higher plus side, middle plus side. So now there also you have to give justification. More importance to you have to give to excessive plus size and less importance to less plus size. So A is ruled out. C. How can you assess for every patient whether he is a typical size? Involves a reassessment of what represents a typical size. How can you, are you authorized for assessing? Okay. So there is no way. It depends. Person to person, place to situation, age, height, weight, body, everything. It depends. Okay. Right. So by default, you can understand here that B is the right answer. Size, whatever the size is, you have to care for the patients. The approach is equal priority to everyone. A patient is a patient. And nothing that like more attention should be given to this patient, less attention should be, no. Everyone should be given. Okay. According to their needs. According to their needs. For example, an old lady is there. She cannot walk. So you have to care for that patient. For example, a person is there, young person, but his bone is broken. For him also you have to give importance. Okay. A person is very strong, He can walk, he can stand, he can even run. But he's telling, I am giddy now. I am giddy. Oh, you are not old. Your bones are not broken. You're only giddy. Why should I support you? No. According to the needs, patient, when he wants that time you have to provide care, whether it is whatever category it is, equal priority you have to give according to the needs required by the patient. You have to accommodate yourself. So B, logically the answer. People don't understand these things. They don't want to listen to these things also. They just want to go to the exam and write the marks, write the answers and fail there 2-3 times, then come back. Yeah, unmute please. Jasdeep, is that clear?
Yes, sir. Clear, sir.
Do you need audio for this one? This is nonsense for me.
Yes, sir.
Special provision. How can you say special provision to some and non-special provision, ordinary provision for others? This is gone. Huh? Typical size. How can you say typical size? That means again you are categorizing. So typical size. So if it is a typical size, it's okay. If it is not typical size, then we will give special provision. Typical size is no problem. Non-typical size is plus size. So again the same thing is what is there in A, again in C. Typical, this is perfect size. That means the other is imperfect size. How can you say this is perfect size and this is imperfect size? Whatever the size is, it is your responsibility, right? So
Yes,
first
sir.
one is telling special provision for plus size. Third one is saying typical size. Typical size means non-plus size. So that's the opposite. So here also you are grouping them into two groups and showing disparity, inequality. Typical size means, oh, very good, proper, no problem with these people. That means problem with the other people. That means try to understand this. It should be uniformity. It should be uniformal attention, uniformal care, equal distribution of care to everyone. What about you, Ruwani? Is that able to understand? Are you able to
Yes,
understand?
sir. Yes, sir.
You understand why you are not getting the answer? Even without audio, you can get the answers, right?
You're right, sir.
If you
Yes,
do
sir.
like this one for some days, then you will get. Huh? You have to try like this one. I will teach you, but afterwards you have to go and search and try everything.
Okay, sir.
So that is the third question. Next, accommodate is able to accommodate the needs of people of all sizes, all, universal. Here all means equal. All sizes means equal. But here special provision means normal provision. Typical size means non-typical size. Both are disparate. Those are differences. But here it is equality. This is equality with the difference. So let me give you here. This is equality. Equality. This is inequality or a difference. Special. For someone you are giving special. Others you are treating differently. Difference. Here typical. Typical means non-typical. Here also difference. So these two are going into one category, that is going into another category. Equality is the right answer. So both are different. So two answers cannot be right. So this may be the right answer. So this is the way how you have to analyze the question. Yeah. Next. So special means non-special. No, not fair. Unfair. Is able to accommodate the needs of peoples of all sizes. All are equal. So yeah, fair treatment. Involves reassessment of what represents a typical size. Typical size means what about the non-typical size? You are selecting this is the proper type and these are improper type. So that also difference, not fair. This type is good, this type is not good. This type is okay, this type is not okay. That's the meaning reassessment means. This type is not obese, this type is obese. That is what you are differentiating. Okay. They are obese, no problem, but forget that and treat them equally with everyone. Okay, because every patient is an individual. All right. Next question number 14. Go through the question, please. Yes, question number 40. Lianne says the greatest problem with the specialized equipment for plus-sized patients is often. So the greatest problem regarding equipment with plus size. So greatest problem, we know that it is plus size patients. We know that it is equipment, the greatest problem. So what is the problem? What is the greatest problem? So there will be problems, ordinary problem, average problem, and most serious problem. So there are three types of problems you can say. So problem. Okay. The problem. So problem. Now when he is telling problem, he is telling the greatest problem. Superlative degree. Now this is superlative degree. So what do you mean by this question? Try to understand here. Superlative degree. So that means there are 3 degrees. One is great, one is greater, one is greatest. That means this is the topmost, highest level. So there are 3 types of problems here. One is great problem, one is a greater problem, one is greatest problem. That means ordinary problem, average problem, and serious problem. So 100% problem, 50% problem, and 0% problem, or 1% problem. You can think like that. So problem means problem, 1% or whatever it is, even 1% is a problem. So 1%, 50%, 100%. So the greatest problem is 100% problem. So all that problems only. So he may talk about ordinary problem, he may talk about average problem, he may talk about the greatest problem, he may talk about no problem also. He may say maybe problem also. Okay, 1 second. Yeah. So problems are categories here. Okay, the greatest problem. We are not talking about the patients. We are talking about the problems of the equipment. Okay. What is the problem here? Not ordinary problem, not average problem. The greatest problem means above 75% problem. Most serious problem. For example, he may say this is not a problem. This may be a problem. Or this is a small problem. This is an ordinary problem or average problem. Or this is the serious problem or the most serious problem. Something like that he will be talking. So there may be all our problems may be there. And which is the serious problem you have to see. Now, the first one. A limited range is available for hospitals to choose from. A limited range, plus-sized patients. Okay. Specialized equipment. First one is hospital should accommodate. Second one is a special equipment should be there. And third one regarding the problem with the specialized equipment for plus-sized patients. Hospitals, are they available? Are the specialized equipments available in the hospital for these plus-sized patients? So availability is the problem. Availability. Okay. Availability. Now let us study these points. First one, a limited range is available for hospitals to choose from. Okay. Equipment, specialized equipment, limited. Limited. Okay. It is limited. Range is available for hospitals to choose from. So limited. Equipment is limited. Not too much. Limited. Controlled. Restricted. Short. Lack. Okay, hospitals lack the resources. Hospitals lack the resources. So resources to invest in the quantities needed. Invest in the quantities needed. So they have financially weak. Hospital lack the resources to invest. Means finance. Money. So for example, if they want to invest in beds, for example, plus size beds. Okay. They need to invest more money. So the hospitals lack the resources. So here limited equipment, here limited resources, here limited equipment, specialized equipment, limited range. Here lack resources. Lack resources. This is financial aspects. Here equipment is limited. Here resources are limited. Lack means limited. Short. Here range is limited. Range is short. Same word. Limited means lack. Shortage. Okay. The physical layout of the hospitals can't accommodate them easily. Physical layout. Layout of the hospital is the problem here. Here lack of space. Okay, layout, plan. Here equipment is limited. Here resources are limited. Here layout is limited. Okay. The physical layout of hospitals can't accommodate them easily. Layout. Layout means what? Positioning, the planning, the building. Okay, layout means the infrastructure, not the building plan. Layout means building plan. Okay. Layout means building plan. See, for example, if the hospital is in a very big, spacious accommodation place, that means they can do whatever they want. But if the hospital is run in a small building or small area or by the side of the road, and the area is not sufficient enough, so it's very difficult to accommodate such special cases. Okay. It's very difficult. Because every hospital normally caters to normal patients. Okay. So what is the problem? Limited range is available for hospitals to choose from. Range is there. Hospitals can choose whatever equipment they want. If they want beds, they can buy. If they want wheelchairs, they can buy. If they want carry, for example, a person is there, he wants to carry a roller, they will put them on that, what is that? Stretcher. Stretchers they will buy. Or rolling stretchers they will buy. Or stretcher on wheels they will buy. Or wheelchairs they will buy. Whatever they want they can buy, na? How can you say there is a limited range of specialized equipment? Equipment is there in the market. They can choose variety of equipment. They can purchase, they can buy. Hospitals can buy any type of equipment if they want. There is no limited range. If they really want, they can buy, purchase from abroad also. They can purchase from America, Russia, China, Canada, anywhere they can purchase. If they want, they can definitely purchase. Is there limited range of available for hospitals to choose from? They can get anything they want. They can procure, only throw money and get anything they want. They want beds, big size. Yeah. Lesser size beds. Can't we get? If they cannot get, they can make them prepare. They can ask the carpenters to do. Or they can ask the blacksmiths to do. If they don't have that one, they can ask a mason to make a cement bed. They can do anything they want. If they want, if they are interested, there is no lack of the range of equipment. Equipment will be there. If they are not there, you can create them. Is there any limited range? For example, okay, if a hospital wants anything, they can buy, right? If they want a bed for a person who is weighing 200 kgs, yeah, they can purchase. Why not they can purchase? If it is not there in your city, they can buy from some other city. If they're not in the country, you can buy from some other country. Definitely these size people will be there. If nobody is there, you can put two cots side by side and fix them. What is the problem? Is it lack of availability? That's a lame excuse. Common sense, lame excuse. How can you say we don't have for a patient? For example, if in your house somebody is there, your great granny, who is 160 kgs, okay, she becomes obese, suppose, will you say no? Don't you have that love to procure for them? Okay, no problem. We have 2 beds. Granny is coming here to our house. We don't have bed, so don't send her here. Will you say like that? What you will tell? Even the children will say, no, mama, you give my bed. Okay? I will sleep down, or I will go and sleep with papa, but you can give my bed. These 2 beds you can join. One extra bed is there, and along with that bed is this bed. 2 you can join and give for granny, because I love granny. Even young, small children say. They cannot say that there is no equipment. How can you say no equipment? If you cannot buy also, you can put a cement slab like that one, and you can ask her to, you can put one cushion and you can make her rest there. There is nothing called limited range. Intent is prior to content. Okay, intent. What is there in your heart? If it is willing, you are ready to do anything. How can you say it is not available in the market? You can choose anything you want, any style you want, you can choose. There is no limit. Sky is the limit if you want to provide. Anything you ask, it will be there in the market. You just have to Google or search or find out and buy it, that's all. Equipment. If you don't have also, you can give special order and they'll specially give for you. For example, in some houses I see, what are these beds? Beds, single bed, double bed, queen size bed, king size bed. And even bigger than that also, if they want Maharajas and Maharanis, they may have Maharaja bed maybe. You can specially order. What is the problem? Huh? Sky is the limit. That's the point. Okay. We cannot say no. If they want, they can get. So by default, it is ruled out. Next one. Hospitals lack the resources to invest in the quantities needed. Hospitals lack the resources to invest in the quantities needed. How can hospitals lack the resources to invest in the quantities needed? If it is a government hospital, government will provide money. Try to understand. Government has to provide money. Hospitals lack the resources. No. How can government say no? Okay, private hospital. If it is a private hospital, you are investing. So you have the money, you generate the money, you do something. Definitely you will do. And you will try to explore and flaunt that situation. For example, you can advertise in the newspaper, radio, television that we have mega beds for plus size people, if anybody. So that is more attractive. That means these people also we are ready. Yeah, there are hospitals which show like that. We have CT scan, we have this one, we have that one, we have robotic surgery. Why they are doing? Hospitals lack the resources? No. Governments can spend money. Private hospitals can spend money. They can earn money with them also. So, hospitals lack the resources is not right. To invest in the quantity, it is needed, means they will provide. For example, something is needed means government will provide. It has to provide. Private people, yeah, they have to provide because it's an income generating source. Government service-oriented responsibility. For private organization is income generating responsibility. So both ways. They cannot say they lack the resources. If it is going to generate income, they will take loan and get that one. There are many hospitals like that one. They'll multiply. Okay. So try to understand this one. So that's okay. Hospitals don't lack the resources. Third one, The physical layout of hospitals can't accommodate them easily. For example, a hospital is already there. A hospital is already there. It is a small hospital by the side of the road, and you cannot extend, you cannot expand, you cannot build another floor, you cannot do anything. Yeah, this is a chance maybe. The hospital layout is such that it is a fixed one, and this much only place is there, plinth area or total surface area is this much only. Now, how can we do this one? How can we accommodate special equipment for plus size patients? Because our area is limited, our layout is limited, this much only. This is the doctor's room, this is the guest room, this is the visiting room, this is surgery room. We don't have that much space. If we have space and empty space, something like that, we can construct another room somewhere adjacent to that one and we can expand. But we don't have that. Our layout doesn't permit. Okay. Because in cities, the place is very difficult. Okay, very great difficulty you get. For example, a school needs a playground. They cannot get the playground because everywhere it is 3-4 floors, buildings have gone up. So you cannot expand in any way. And the government will not give permission, additional permission, just like that. So, purchasing equipment is easy. That's not difficult. If you have money, you can purchase. You don't have money. How can government doesn't have money? How can government not have money? How can private organizations not have money? They have, or they'll take loan, or they'll do whatever they want. But physical layout of the hospital, this cannot be changed. Okay, so easily, right? Procuring additional space is very difficult. Procuring things are easy. Procuring financial resources are easy, but procuring the layout of hospitals, additional space is very difficult. So try to understand this one. Plus size patients, equipment are in the market, you can buy and get. Okay, resources. You governments have money, they can allocate funds. Finished, that's all. Given 2 crores, finished. But layout of the hospital. Now, what about the hospital? How can they accommodate? Because it's a fixed place. It's not so easy. Again, you have to build another room. It's not so easy. So that's the point there. Getting money is simple task. Getting equipment is simple task. You give money. First, getting money is easy. If you get money, you can purchase things. But what about the hospital size? Plinth area. We call the plinth area. Total surface area. Which is there. That's what you already used that. Now, how can you arrange a special room for special bed? So try to understand this one. So the first one is talking about range of equipment. Okay, this is range of equipment. This is resources, means money to invest. This is layout. Layout is limited. Layout is limited. For example, somebody is coming, you will do it. For example, somebody is coming. Okay. So you can buy one bed. No problem. That's easy. Another 2 beds. Okay, one family is coming. Okay, we'll buy 3 beds. If not, the 3 mattresses, they'll sleep on the floor. No problem. Some equipment you can get. That's not a difficult task because you can just purchase from the shop. Okay, second thing. Okay, resources, financial resources to invest. To buy these things, mattresses or beds, to buy them. What happens? You need money. Okay, they are important for you. So what you will do? What you will do? If you have money, you will use it. Like government. If you don't have money, you will take a loan or you will ask somebody. You cannot say, my father is coming, my mother is coming, my sisters are coming because there's a birthday party in my house. Okay. So you cannot say, no, don't come. So you'll go and ask your friend, okay, my salary is finished. So next month, first, I am giving you an advance check. You can take it from my salary. Now I need to borrow some $20, 2,000 bucks, something like that. You'll ask and you'll take a loan, okay, from the office or friends or from the bank, and you'll do something. But what about the place? Can you add already 2-bedroom flat, one kitchen, two bedrooms, and one hall? Can you add one more room to them and give them a separate room? No. We'll adjust. So this layout is difficult too. That's the biggest problem. Buying things is not a problem because already house is there. We can buy some things. Okay, we don't have money. We will get some money. But what about the area? Okay. Because most hospitals, they have space. They will try to maximum utilize all the space available. And now how can they accommodate additional features there? That is the problem. Try to understand this. You have a house. Getting an extra room is very difficult because all the entire area is already constructed. You cannot have a separate room there. So money you can get to buy things. That is not a problem. But this special equipment, buying the equipment, number one, arranging money for the equipment, number two, arranging the place for the equipment. The first one is buying the equipment. Okay. Available equipment, buying the equipment, first one. Second one is providing finance to buy the equipment. Third one is allocating the space. Okay. So first one is items. First one is which items? Okay. First one, A is the items. Items you can get them if you want. Second one is money to buy the items. Money to buy the equipment. Yeah, money you can get the equipment. But the space, this is the problem. Items are not the problem. You can buy them if you have money. Money is not a problem. If you don't have also, you can borrow. But you have money, okay, to buy the things. So you buy the items also, but you will bring to the house. That is also right. But where will you put these extra things? Where is the space for you to put these extra things? That's the point here. Okay. Buying is not problem. Money is not problem, but space is the problem. So the biggest problem might be space. Logical reasoning without any audio. We are trying to guess. It may be right. It may be wrong. It may be right. It may be wrong. That's not my problem. My common sense says that these are right. Maybe right, maybe wrong. Maybe I'm not saying it is right. I'm saying maybe right. 50% chances are there I'm wrong. Okay. Or 33% chances are there I am right. But at least I'm doing some work. Ne? Right. The first one is item. Second one is money to procure that item. Third one is space to place the item. Okay. That's it. Now 41. Go through the question 41. Okay. 41. how does Lianne respond to the question about the safety issues? So safety issues means problem related to safety, presented by plus size patients. We know plus size patient. How does Lianne respond? Okay, what is her response? Okay. She accepts that training in this area needs to be improved. Training should be improved. So training is the problem. Excellent training is not provided. So training needs to be improved. Training is not excellent. That is what she's accepting. She's saying we don't have proper training. So training problem, safety issues related training. There is no training or no proper training. No proper training or less training. So more training is needed. From less training to improve the training. Training is not perfect. So improve the training. Training is needed more. The training which is there is not sufficient. So she is accepting. She outlines some principles to apply to minimize any issues. So outlines some principles. Some principles to apply to minimize any issues. Minimize means reduce the issues. Some principles to minimize the issues. If you apply the principles, issues will be reduced. So principles, problem with principles. So people are not applying the principles, means rules and regulations. If you follow the rules and regulations, the issues will be reduced. For example, when you are treating the patients, there are some rules and regulations. There are some guidelines to follow. If the nurses follow these rules and regulations, the procedures which are directed to them, the issues will be reduced. If they are organized, systematic, okay, perfect, timely, everything is right, then there will not be too many problems. If they are unsystematic, if they are irregular, they are not attentive, not focused, then issues will be more. Okay. If the patients have some problem, you are attentive, so issue will not be there. If you are not attentive, you are talking on a mobile with your friend or you are watching a video and the patient is there. Okay, you are not attending the patient. You are next to the patient, but you are watching a video with your headphones on and your eyes are on the mobile phone. Then what happens? The patient will fall down. So there is a safety issue there. So if you are monitoring them very carefully, there's no problem. Otherwise, what you can do, you can keep a pillow, okay, on both the sides so that he will not roll, okay, and fall down. So try to understand that. Or some cushion, he will not fall down. So, or when he's sitting in a wheelchair and you are pushing, maybe he will fall down. If you tie a belt or something like that, okay, or if you hold him properly with a shoulder, he will not fall down. So there are some techniques or principles or strategies or rules and regulations. If you follow, if you apply these principles, then there will be less problems. So is she talking about training before treatment, or is she talking about rules and regulations or principles while treating the patient, or she makes a case for increased levels of support from nursing staff? Increased levels of support from nursing staff. Okay. She makes a case for increased levels of support. Support should be increased. Support should be increased. Okay. So training should be increased. Principles should be used to minimize the problems. Okay. Or support should be increased. Training before joining the elderly people, obese people, plus size people. Then principles, so rules and regulations to follow when managing them. Other support from other nursing staff should be increased. So that means the nursing staff support is less. Nursing staff should support more. The plus size patients, they should support more. That means the support which the nursing staff is giving is less. So first one, training should be more. Second one, rules and regulations should be more. Support should be more. Training, the staff should be more. Rules and regulations should be more, so that problems will be reduced. Support should be more. Who's the training staff? Nursing staff. Support should be more to the patients. More support. So now, is he talking about training? The 3 points which are very, very important are, so safety issues, safety problems. So training regarding safety should be given, or rules and regulations regarding safety should be more, or support should be more. So try to understand this. First one is training before starting work, in advance. Principles when you support the patients. Nursing staff support is less, so increase the support. So regarding safety, what should you focus? What is she telling? Training is less, so more training is needed. So problem is with the training. Problem is with the training. And rules and regulations are not followed. So follow more rules and regulations. So rules and regulations are not applied. So apply the rules and regulations. So you will get benefit. Next, third one, support is not enough. So give more support. So training or principles or support. Where is the problem? Safety issues is where? Where are the safety issues? Is in the training? No proper training. Is it in the principles? The rules and regulations are not followed. Is it in support? So the staff or nursing staff are giving less support to the patients. So more support should be given. So the problem areas, 3 problem areas we have identified. Training is the problem. Rules and regulations or principles is the problem. Support or care is the problem. Now you have to understand here. Okay. You have to understand here. We can say that training is already given every time to the nurses well in advance. 4 years of nursing training is already there. And in-service training is there. The job profile, when you go to a new department, training is there. Weekly trainings are there. Monthly trainings are there. And a new equipment is there. That every training is already provided. So there is no problem with training. Training will be always provided to the nurses. So I don't think this will be the problem, because without a proper training, nurse will not put on her nursing dress and go to the patients. So most likely A is not the right answer. Most likely. Next one, B. Principles, rules and regulations. These are human errors, you know. They want to do, but they will not follow. They are not very careful. They don't, all the nurses don't follow. They're not, sometimes they follow, sometimes they don't follow. Sometimes they don't give response. They don't give importance to rules and regulations. Okay. For example, they say cleanliness is very important, but every time are you following cleanliness? Sometimes nobody is there, so you will just manage like that one. So many rules and regulations are there. Who will follow all these rules and regulations like that? So this may be 50-50 chances for this one. Some people may follow, some people may not follow. That is the reason why maybe problems in the hospitals. Okay. So third one, she makes a case for increased levels of support for nursing staff. So support for nursing staff. Increased levels of support for nursing staff. Nursing staff, they need support. For example, if it is not enough, they will be given support, definitely. Okay. For example, there are 10 patients and 2 nurses are only there. Okay, 10 patients, how can I manage? I need somebody else. So now the patient is more. Emergency department, too many patients are there. So they'll bring 2 more nurses from other departments where there are less number of patients, like that. So support will, so for example, there are no nurses, then there will be some social worker, or there will be some other employees or some support staff or temporary nurses will be given. So now increase levels of support. That's what it is. So if required, nursing staff are needed. If they ask, they will definitely be given support. It's not that they will not be supported. For example, patient's responsibility is very important. So everyone will be there. For example, nurses have to give support to the patient. They will definitely do. It is their duty. So they'll definitely do. So this may not be the right answer, because normally patients are there in the hospital. If the patients are not given support, the task will be, the nurses will be taken to task. They will be questioned, why are you not doing like that? Because patients will complain. But some rules and regulations, if they don't follow, so they're not ensured always. They're not made sure to follow. Sometimes everyone cannot follow everyone. So it's very difficult. So these rules and regulations, sometimes they will ignore. Or for example, you should not use mobile phones. That is a rule. But when somebody is not there, these people will open their mobile phones and they may watch a video, or you should not talk with somebody else. Simply. So then what you will do, you will go to the window and you'll watch. Your duty is to watch the patient, sit there and watch the patient. So instead of that one, they'll go to the window and they will be seeing somewhere outside. So for example, 1 second only, no, I'll go to the washroom and come back. I'll go to the canteen and come back. That 1 minute without assigning your responsibility. What is there 1 minute? Nothing will happen. You will go. But somebody has a problem. So the rule is you have to intimate some other nurse and assign that responsibility to the nurse. I'm going to the canteen. I'm going to the washroom. Just to bother about my patients for 2-3 minutes until I come. It is your responsibility, please. So that you ignore. Yeah, what is there 1 minute? Like that. So chances are more likely for B. Rules and regulations. We'll take them lightly. We'll take them lightly. We don't pay attention to that those instructions very seriously. That's the problem. So that is the case. Most probably the answer might be B, rules and regulations. Why rules and regulations? To follow. Why you are giving rules and regulations to follow? Because you think that they will not follow. That means, yeah, there are chances that they will not follow. So that may be the answer. Why rules and regulations are given? Because people won't follow the rules and regulations. If you don't tell these are rules and regulations, they will not follow. They are to be followed, but they will not follow. But that is the reason why they will put these as rules and regulations. To make sure. The word rules and regulations means mandatory. If it's just to say procedure, they will not follow. If you say rules and regulations, they will follow. So that's the point. Okay, principles means rules and regulations. Remember that. Most likely B is the answer here. Next one, last 42. Go through the 42nd question. Okay. Now last question. Actually, part C is very difficult, very difficult, very difficult. People will say, but actually it is very easy, very easy, very easy. Easier than part A, actually, if you apply common sense. So when asked about the human dimension of caring for plus size patients, human dimension of caring for plus size patients, Lianne underlines the value means most important. Most important. What is most important here? What is more important? Caring patients. So you are caring patients. Patients are very important. Caring patients means patients are very important. So patients will be there in every line. Patients. Patients will be there everywhere. That's it. Okay. So involving patients in decisions about their everyday care. So everyday care, involving patients. Who is treated? Patients are treated. And you are taking decisions. Okay, about their everyday care. So what you have to do, you have to involve the patients. Tell the patients. You cannot just, this is injection I'm giving you. No, this is injection. I'm going to give this injection. Okay. There are two aspects. Shall I give you injection or shall I give you a tablet? Okay. So injection, I'm going to give you injection. So this is very painful. So I think I can give you on the buttocks or on the shoulder. So where should I give? So you can ask. Then he will tell, yeah, yesterday they gave me an injection on the right buttock and today you can give on the left one. So like that. So you have to discuss with the patient. So If you discuss with the patient, that's fine because you are dealing with the patient. If the patient is not ready to be accepting, then you cannot treat him. If he says no, what you will do? Huh? If he doesn't like injections, what you will do? You have to tell him. You have to guide him. You have to educate him. You have to appease him. Okay? You have to involve him. So chances are there. Yeah. For example, a doctor, when he wants to give an injection, he tells, see, this is your condition. I think it's an important thing that you have to take an injection because tablets are not enough. It should go directly into the veins, okay, into the body, into the muscles. So what I suggest you is injections. What do you say? Are you okay with that? If he says, okay, doctor, I'm okay with that, then that's it. If he says, no, I'm not okay, is there any other alternative? Then you will say alternative or tablets are there, but the tablets will not effective. Now you tell me, are you ready to accept? If you say tablets only, I'll give you tablet, but that is not going to help you much. So you have to guide him. You have to make him understand. You have to tell him why it is right, why it is wrong. So if you involve the patient and to take a decision for himself, because you cannot take decision for him. If he says no, then what you will do? If you say no, what you will do? So that's it. So you have to tell them. For example, I have taken 2 tests. In both the tests, it's a positive for what is this diabetes mellitus. Now, what I will say, patient, I'll say I'll go to another doctor. Okay, let me tell you one thing. You have already taken 2 blood tests, 2 tests for what is this? Blood sugar. Okay, diabetes mellitus. It's confirmed. There is no question. Even if you take 100 times, there is no use. 2 instances are enough to confirm. 1, okay, we can still doubt. The second one confirms it. So there is no need of a third one. This is according to the World Health Organization's mandate. That's enough. You go 10 times, it will never show negative now. That's clear. It's confirmed. So you have to tell them. Now tell me what you are supposed to do. Still, if you want to go, you can go. I cannot do anything. So it's mandatory that you have to take injections. So something like that. Right. So now coming to the point, ensuring that patients appreciate any concerns the staff may have. Ensuring that patients appreciate any concerns the staff may have. Why should they bother about staff? Staff have concerns. Why should they bother? If the staff has concerns, send some other staff who has no concerns. For me, my priority is important. Why I should bother about the staff's concerns? Staff have some problems. So what is my problem for that? Huh? What is my problem? That is staff's problem. That is hospital's problem. That is not my problem. Why should patient bother? Oh, nurse, you are very weak. You have fever. Okay, no problem. You don't give me injection. I will take injection myself. That is nonsense. Huh? Staff has a concern. She has fever. Now only one nurse is there. And she cannot give injection. She is afraid. Her hands are shivering. She has high fever. Now will the patient appreciate her? Oh, nurse, you have fever. Still you are taking care of me. Thank you very much. I appreciate you. You have some concerns. No problem. I will not take injection today. Tomorrow I will take. No problem, nurse. It's nonsense, right? Why should patients appreciate staff's concerns? If the staff have concerns, let them stay at home. Let them take leave. Let somebody else be substituted. There is some other alternative. That is the responsibility of the hospital. That's the responsibility of the in charge. That's the responsibility of the senior nurse. A staff who is already has some pain or concern or issue or worry, she is not supposed to do the duty itself. You have a problem. You have some difficulty. You have some pain in the stomach. Or you have headache. How can you do your duty? And why should patient appreciate your problem? It's nonsense, right? B is nonsense. Why should patient think about your problem? Nurse should think about patient's problem. This is ulta, wrong. What is it? Why should a patient be concerned about your problem? Nurse should be concerned about patient's problem. Patient is coming for a problem, and a person who has problem can take care of another problem. No. The other person should be problem free to solve the problem. So a concerned staff should not be on roll duty. She did not sleep all night. She went on a trip and came back. By the time it was, she thought that she will come yesterday night, but she came today morning. And directly you are coming to duty. How you are very much concerned. You don't have sleep, you have problem, you are tired, you are restless, you are irritated, you are upset, you are hungry, whatever nonsense things you have. But why should the patient be bothered about all your concerns? You have a headache. Okay, go and send another nurse. I have to get my injection, right? Will you go and tell your doctor or your superintendent or your manager saying that, doctor, I have a headache, so I will not give injection. You only give injection. I will not give. My hands are shivering. And he will say, go, why did you come to duty? Who asked you to come? If you had told me, I would have asked somebody else to take your place, no? That is what you will be asked, told. So nobody will appreciate. If you have concerns, you are not supposed to be on duty there. So B is ruled out. Respecting patient's wishes about how their size is referred to. Respecting patient's wishes about how their size is referred to. Size is referred. So respecting patient's wishes about how their size is referred to. Size. So proper size, improper size. Again, this is ruled out. How can you differentiate people, patients, according to their sizes? Oh, this is good size, this is bad size. How can you do that? Patients' wishes. If their size is plus, you have to respect their wishes. If their size is not plus, you should not respect their wishes. Is that like that? Size? Oh, size. Size. Plus size? Respect them. Not plus size? Don't respect them. What does that mean? So this is, by default, this is the wrong answer. Huh? Oh. Is that clear? Jasdeep?
Yes, sir. It's clear now.
My God. You tell me, no? Sir, when you are explaining, it is very easy for us. I'm also doing this one for the first time now. Okay? Involving patients. Okay? Involving patients. So patients are the problem here. So patients should be respected. Appreciate any concerns as staff. Staff are the problem. They have concerns. Okay? Staff are the problem here. So you have to value the patient's problems, staff's problems, and size problems. So patients, you have to value the patients. You need not value the staff here. Staff's problems are not valued here because by default, if they have concerns, they are not supposed to do the duty. Size, whatever the size, you should not disrespect anybody. So C is ruled out, D is ruled out. Patients, any patient, anytime, every day, anything, you have to tell them and you have to take their acceptance or decisions. Okay, you have to tell them about the decisions and they have to involve them and you have to take their agreement, consent. Then only you have to do that one. Without their consent, you are not supposed to do anything. Okay. Staff's problem. Oh, staff's problem. Why should they come for duty? They can stay at home only. Why? Somebody else will come. I need injection. No, patients need injection. If you have some headache, what is my problem? I have to take the injection by all means. If you cannot give injection, that's not my problem. Okay. So be careful. Here, size. So that means you respect them according to their size. Huh? More respect for plus size, less respect for non-plus size. Is that so? So value, what is value? Patient is valuable or staff is valuable or size is valuable? In the hospital, who is valuable? Patient is valuable or staff is valuable or size is valuable? Patient is valuable. If there is no patient, there is no need of staff. Okay. If there are no staff, also patients will come. Right? But if there are no patients, there is no use of staff. Remember that. Okay. If there is no nurse, doctor will take care of the patient completely. Or he will ask somebody other nurse. So any individual, if that doctor is not there, another doctor will take. But if this patient is, that patient needs treatment, that's all. That is important. Patient needs treatment, that is important. You cannot say if this patient, if not this patient, another patient, you cannot say. That patient is important. You have to involve him, you have to treat him. The value is patient more. Staff, nurse is needed. If not one nurse, another nurse. But it's not the case with the patient. Oh, this patient will go, another patient will come, no problem. No. Every patient is important here. But staff, if not one nurse, another nurse. If not one doctor, another doctor. If not one hospital, another hospital. But patient is patient. We cannot ignore a patient. So valuable patient. Size is not important here. Size is not valuable. Whatever the size is, patient is valuable. Remember that. Try to understand multiple ways you can understand what is the right answer and what is the wrong answer. Shall we play the audio and you will do the answers now?
Yes, sir.
Yeah, Ruwani.
Yes, sir.
What is the time for you now, Ruwani?
Mm, 10, 20, sir.
Okay. Now you understand. You have to give time like this. Huh?
Mm,
10 days you are very busy. What can I do?
Yes,
Tell
sir.
me. Right. We'll play this audio and we'll do the answers. Afterwards, you can check the answers.
Occupational English test. Listening test.
This test has
Can you
3
hear?
parts. In each part, you'll hear a number of different
Can you hear,
extracts.
Jasdeep?
Medication for high cholesterol. And that generally means a daily dose exercise, often reflecting the habits of a lifetime. So it's clear that we should be talking statins lower L out by a gene that can cause ill disease will be treated. A drug called Partisan that was licensed in 2019 to treat amyloidosis. And work is continuing on similar drugs that could treat things like Huntington's disease and preeclampsia. So, in rolling out these injections to control cholesterol, we should be looking at the future of how all disease will be treated.
Get ready.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear an interview with a nurse called Lianne Haydock, who's talking about the issues involved in caring for obese or plus-size patients. You now have 90 seconds to read questions 37 to 42.
Today I'm talking to Lianne Haydock, a nurse with a special interest in the care of obese or plus-size patients. This is a real issue, isn't it, Lianne?
It is. The number of people carrying extra weight's been on the increase for some time. Obesity now affects around 1 in 4 adults in many Western countries, and it's known to be associated with increased risk of health conditions including type 2 diabetes, heart disease and stroke. But we shouldn't forget that the reasons for this increase are complex and often very challenging to understand. So addressing the root causes of the issue isn't the job of health professionals on the front line. Our job is to offer optimal care for these patients. And this means moving away from treating them as the exception to the rule, towards making them an integral part of what we do. I'm committed to that idea, but making it happen is easier said than done. It means a major shift in both attitudes and policies.
So what sort of attitudes towards plus-size patients have you come across?
One issue they face is the very common misconception that they're somehow responsible for their size, that it's simply a lifestyle choice. Even amongst health professionals, you'll get comments like, if they just lose weight, there wouldn't be an issue. This is so unfair because the reasons for obesity are enormously varied and complex, and I find comments like this very disheartening. I can understand that it's human nature to judge other people, to wonder why someone's become so overweight, to feel that it was somehow avoidable, but none of that justifies offering this patient group anything but the best possible standards of care, and that's what we should be aiming for.
But treating them must involve adopting a different approach sometimes.
Yes, but we need to focus on finding the best flexible approach that works for all patients. Get away from the idea that the plus-size patient is unsuitable for the setup we have in place. For example, it's the bed that's not suitable, not the patient who's too big to fit the bed. The notion of an average-size patient lying on a bed that isn't large enough, or being expected to use a commode that's too small for them, would be rightly regarded as inappropriate and undignified care. Ensuring that plus-size patients have appropriate equipment and that everyone knows how to use it is crucial.
And specialised equipment is available?
It's not that the equipment doesn't exist. There are specialist versions of most things, from hoists to mobility aids to commodes. The problem is getting hold of these things in many hospitals. That's partly because traditionally it hasn't been a priority for funding, and policies haven't kept pace with changes in society. But there are other issues here too. What really causes headaches is where you can order, say, a large bed, but the doors, corridors and stairs aren't wide enough to get it to you. Many older hospitals weren't designed with the needs of plus-size people in mind. So even if you get the large bed in place, is there enough space for patients and staff to move around easily, and so on?
But clinicians have other concerns, especially around safety issues, don't they?
Well, yes. For nurses in particular, one major concern involves moving and manual handling. If a patient's carrying a lot of excess weight, then more staff may be needed, and there's a greater risk of somebody getting hurt. Turning a patient in bed, transferring to a chair, supporting a limb, all become much more complex and sometimes daunting if the patient is plus size. Clearly, what's needed is a risk assessment, and information sharing is central to that. Being able to map out the patient journey and anticipate needs helps us provide the best care. So, for a routine admission, nurses should know how the patient's going to arrive, where they're going to sit, etc., and not be suddenly confronted by someone whose needs can't be met.
And what about the human dimension?
Well, a key part of optimising care for these patients is avoiding assumptions about their capabilities. Nurses should have conversations with patients, ask how they normally handle specific tasks at home, and see if this can be adapted into the healthcare setting. As one patient put it, "We know we're large. We might be living under some delusion about the extent of it or the damage that it may do to our long-term health, but we're not unaware. So although the subject needs to be handled with sensitivity, tact and dignity, it's relevant to care that it happens. And another important thing to remember is that the patient may feel worried on your behalf and be keen to work with you to reduce any risk.
Yes.
That is the end of Part C. You now have 2 minutes to check your answers.
Okay. Now response key. Answer key. Yeah, check your answers. Yeah, you can check your answers. Yeah. How many of your answers are right? How many of our guesses without the audio are right? Just check. Check and tell me, please.
All right, sir.
Our guesses without the audio, all right? Really?
Yes.
All right.
Really?
Yes. Yes,
Huh?
sir.
So that means our logic is working, right?
Yes, sir.
You are only telling, I don't even, I did not see just that answers I don't remember, these answers I don't remember. They are in front of you now. So we are just logically deducing. So if you say all are right, that means our logic is working. Because the questions will be prepared in that manner only. So how many you got now?
6, sir.
6 out of 6. Very good. Sir, just so. Simon, sir. Oh, when you are teaching, it is very easy for us, sir. But when we are doing, you are doing like this, like how I am doing. Huh? You also go and try do like this one. Slowly, slowly, time will be reduced. This is called learning technique. Gradually, you
That
become
is the
master of
end
this
of the
one.
listening test.
Gradually, you will become a master of this one. Okay. Right. That's fine. So that's the end of the test. So CAB, CBA. Right. So we finished one full test for listening. Now we'll start one reading after some time. Okay.
Okay, sir.
Okay,
So how
sir.
much time
Thank
did
you,
we
sir.
take so far?
What, sir?
How much time did we take now?
Uh,
What time did we start?
1 sec. 9, sir.
Now what is the time?
11:30.
So 2.5 hours over, huh?
Yes, sir.
But you understood everything, na?
Yes, sir.
Huh? So
Yes,
that
sir.
is your brain capacity. That is what you can work. Work like this and you will improve. Okay. So
Sir.
I'll take a break. I'll have my lunch now. It's already 4 o'clock. Then afterwards we can start slowly. Okay.
Okay, sir.
Okay. Ruwani,
Okay, sir.
you sleep late, no problem. Morning you'll, anyhow you're not going for work, right?
Yes, sir.
You do work now. Night you study. Morning you sleep. What is the problem? Correct?
Correct, sir.
And do your because I have been waiting every day. I'm waiting. No, correct or not? So if you come, I can help you. Huh?
Okay, sir. Okay,
Okay,
sir.
then take care. Bye bye.
Bye bye. Thank you, sir.
Thank you, sir.
Yeah, Sandeep, Jasdeep,
Yes, sir.
can you share your experience?
Yes, sir. Sir, today I learned
You
school.
are a doctor. First, you tell yourself what is your name, what's your profession, and how these classes are helping you. Others may be interested, not just like you. You're struggling and you came to me and you're learning like that. Somebody may be interested by listening to your testimony. they may want to join like that one. So share your experience. Come on.
Yes, I'm a doctor, and it's a good experience with you, sir, because now today I learn how to observe that question before listening the audio, and how to analyze the key points, how to the techniques and understand, which is before I was not thinking like that, but now is easy to grab because of you, sir. Thank you so much for that.
Okay. What about you, Ruwani? Share your experience. Ruwani? Hello? Are you there? Okay. Yeah, share your experience.
Mm. Today I learned mm, special without audio listening practice. How to identify answer and options, and your explanation very clear and very useful. Actually, I feel more confidence. I really appreciate your method. Thank you so much, sir.
Yeah, welcome. Okay then. See you all later.